Welcome to Climate Change and Health in Small Island Developing States, focus on the Caribbean. If you require translation into Spanish or French, please use the link posted in the chat and choose your desired language at the bottom of the Zoom screen. You should continue to keep this browser open as well to utilize the chat and Q&A features. Please be sure to scroll down and mute the video. Please use the Q&A feature to submit any questions for the speakers. This session is being recorded. Thank you.
Morning, afternoon, evening, everybody, and welcome to this session on health in COP26. We are hoping to go through some of the key health priorities that have been identified for COP26 from November 1st to the 12th. And we are struggling a little bit with the first speaker for today, so we've just reversed the order. So we will be starting today with Jesse De Maria Kini. He is head of the Secretariat Adaptation Research Alliance and also Plan Adapt's deputy director and is based in Geneva. He is going to talk to us about results-oriented adaptation research, ROAR with the Adaptation Research Alliance, which also speaks to the priorities that have been identified for the health priorities that have been identified for COP26. Jesse brings about 15 years of experience working at the interface of science, policy, and practice globally from several regions of the world, and also has worked with several international organizations, including the United Nations. His work has focused quite widely on climate change adaptation, nature-based solutions, as well as looking at the impacts and how do you include multiple stakeholders in the design and facilitation of climate adaptation program. He is also working in capacity strengthening initiatives and does do some of the teaching and the moderation of courses as well. So over to you, Jesse, for giving us an overview of the ARA.
Excellent. Thank you very much, Ravati, and good evening, good afternoon, and good morning. As you heard, my name is Jesse De Maria Kini. I'm the head of the Secretariat of the Adaptation Research Alliance. We are hosted by South South North, who is based in Cape Town, South Africa, but I'm actually in Geneva, Switzerland. So it's actually evening here, and it is about time, being based in Europe, that I'm one of these evening people or morning people. So it's a pleasure to be here today and to share a little bit about the Adaptation Research Alliance and the type of research that we're working forward towards adaptation. Next slide, please. The Adaptation Research Alliance, it's an international initiative, and it's a coalition of institutions across the adaptation, research, and action communities that brings together a transdisciplinary group of actors. And these are from traditional research funders such as science councils or national research foundations, and action funders such as development donors, multilateral financial institutions, philanthropic organizations, and the private sector. When we bring these actors together, who are motivated by the shared goal of increasing investment in results-oriented adaptation research with a focus on the global South. So as you can see on the screen before you, there's a motivation behind the ARA, and there are 4 points. The first is that there's a disconnect between academic research and action. And this clearly has devastating consequences for communities and countries that are most vulnerable to climate change. And in order to address this, since this has been a longstanding problem, we realize that there's a need to shift the research paradigm. And this shift has to has to ensure that adaptation takes place at the scale and the urgency that is demanded by science. And third, science must engage with action, and action must engage with science until the two are no longer binary concepts, but they're actually interweaved with one another, more so along the spectrum from knowledge generation to implementation. And finally, as you can see in the fourth area, innovative collaborations between multiple transdisciplinary stakeholders, such as policymakers, research funders, action funders I mentioned before, researchers, and down to community-based and grassroots organizations must work together to ensure that solutions are relevant and impactful and sustainable. So the ARA seeks to bridge this disconnect between academic and research action, and contributing to this paradigm by contributing to the paradigm shift by bringing together science and action processes and actors to ensure that solutions are relevant, that they're impactful, and that they're sustainable. So the key role of the Secretariat of the ARA is actually to work with the Alliance members to facilitate and strengthen collaboration among the ARA members, as well as the wider adaptation and development communities. Next slide, please. So what is that we're actually trying to achieve here? It's basically the flip side of these 4 areas that I just mentioned here, but really it is this paradigm shift in the way that research is planned, resourced, and carried out. And this shift spans from catalyzing investments to improving the evidence base for adaptation solutions and supporting capacity building for the most vulnerable. And the Alliance also aims to make researchers a valued partner for policymakers, for practitioners and communities. And by strengthening these research and implementation linkages, we, together with the members, will be able to address the immediate knowledge needs to inform adaptation actions and support innovative user-driven solutions for adaptation. Next slide, please. So here's our theory of change, which I won't go into detail. I realize making a theory of change takes a while and understanding it takes even longer, but rather I'd just like to highlight here on the far right side of the ARA's mission to accelerate and scale investments in action-oriented research in developing countries and increase resilience of the most vulnerable, build capacity and linkages across the research implementation spectrum. And all of this while keeping learning at the heart, as within the adaptation space, we realize that adaptation is a means rather than an end in itself, and that there's a steep learning by doing agenda in adaptation science these days. So to accelerate investments in action-oriented research in developing countries, we must all work through this transdisciplinary alliance, achieving these six outcomes that you see in the middle column. But one previous is the 3 function areas that I'd like to highlight here. And in these 3 function areas, advocacy, research planning and cooperation, and then resource mobilization in delivery, there were originally 3 working groups that were established in early 2020 that were helping the ARA think through these activities in each of these areas. And since around May of this year, the working groups have evolved into 6 work streams. These 6 work streams will help us provide the missing middle, let's say, between the functions in the green and then the outcomes in the turquoise in the middle. So next slide. So the 6 work streams, and this is also just to show an even more complicated slide than the previous one. But through these 6 work streams, which are evidence reviews and analytical backstopping, consultative process to identify research needs and opportunities, a co-creation space, and then tracking, learning, and sharing, and UNFCCC linkages and strategic partnerships and principles in the membership campaign are the 6 work streams. And each of these work streams is slightly different, but all are in pretty much a proof of concept stage. From now, they're in the conceptualization, the operationalization up until COP26, where we have the official launch of the Adaptation Research Alliance. But the first 4 will actually continue as AR core activities and with the second phase or second generation activities beyond COP26. So first, I'd just like to highlight the evidence reviews. Next slide. And just really to say that the core activities planned here include analytical backstopping and assembling and reviewing and synthesizing evidence to flesh out the broader vision of the ARA and also support evidence-based adaptation actions. So we currently have the 4 reviews on the screen, and due to time, I won't go into detail here, but I'd just like to highlight the one that you see that says Policies for Increasing Investment in Results-Oriented Adaptation Research, or ROAR, where we're working with the International Center on Climate Change and Development, or ECAD, to make the case for investing in national R&D, investing 1% in national R&D in adaptation and climate resilience. And this is being done within the V20, so the 48 member states. And we are working with ECAD to actually bring this evidence into that discussion in that forum. Next slide. The second is the consultative processes, and these are to identify research needs and opportunities. So we'll be identifying critical knowledge needs and actions and options for adaptation research. And by doing so, we intend to ensure that the funding and the actions are actually targeting and addressing the right questions. So as you can see on the screen as well, we currently have 4 consultative processes. But what I'd like to also do here is just highlight that the global health topic area, which is focusing on climate resilient health systems, is led by the Red Cross Red Crescent Climate Centre and the UK Health Security Agency, formerly Public Health England. And this process parted from the idea that there is a need to demystify health system complexity, in addition to help strengthen systems in order to respond to climate change. So within these building blocks of the health system itself, alongside other sectors, it really depends on seeing the functions of the system itself from the perspective of climate change. While this is still a work in progress and we don't have any final outputs, I can say that, well, it is in the final process, and the outputs have to be still agreed upon by the topic area steering group. But just to let you know, the emergent areas that are kind of the headlines here that we're looking at are leadership and governance, workforce, information systems, infrastructure, and service delivery, among some others. So this is where that consultative area is steering. Next slide. And this is bringing together the evidence reviews and the consultative processes, which contribute to this third work stream of the co-creation space. And this co-creation space will provide a safe space for diverse stakeholders and adaptation actors to come together to co-create new approaches to address adaptation challenges and to identify emergent adaptation solutions. So we're currently conceptualizing this area around three functions. One would be ideation of some of these ideas to go into a co-creation space. Second is actual facilitation of this space. And the third is an incubation of these ideas and these activities or potential adaptation solutions. And you can see these four orange highlighted areas that are core to the co-creation space. But I think the one that would be really important to highlight here really is this idea of pivoting from a landscape of competitors to coalitions, which is the first. And the fourth, which is very related, which is strengthening networks and consortium. This is, I think, something that we're looking at very strongly here, because they will help facilitate the second, which is actually the co-development of new programs for climate adaptation and adaptation research. Next slide, please. The fourth is actually looking at tracking, sharing, and learning. And here we're currently in a scoping phase for the design and the establishment of a framework and system for tracking, learning, and sharing that will facilitate the ARA members and their partners and other stakeholders collectively to track their progress towards the achievement of ARA outcomes, to actively learn about what works and what doesn't when designing, conducting, and using action-oriented adaptation research. And then also for sharing and learning with each other and other stakeholders in the adaptation space. While this will be a member-focused space for knowledge exchange and learning, we'll also have an external-facing part to ensure that this rich learning that will emerge will go beyond the ARA community into that wider adaptation development spaces.
Yes.
So as I mentioned, yes.
If I may help ask you to,
To wrap up.
Yes, please.
Okay, no problem. So I was just going to say that these first four work streams are underway. There'll be core activities. And then the next two slides, so this next one here you'll see is UNFCCC linkages. So next slide, please. We'll continue on. And this is just where we are working with other initiatives out there, including the UNFCCC initiatives such as the Lima Adaptation Knowledge Initiative, Paris Committee on Capacity Building, to actually identify opportunities to work together. The next slide, please, is on the principles and membership campaign that we're working on, where we've co-developed principles to really underpin the ARA's activities and also bringing in new members. So again, this is a co-creation of the principles, and we're producing a joint statement based around the ARA's activities and these principles to be shared at COP26. Next slide. This is just to show we have 62 current members, and these are just a few of their logos. And again, this is a transdisciplinary group. Next slide, because I just wanted to really highlight here that the COPE plans itself, we're really looking at the official launch on the Science and Innovation Day, which will be November 9th, where we'll have a high-level session. And the next one, please, will be exactly just a couple more of the activities that we have at COP26, which is on the Loss and Damage Day, as well as in the Resilience Hub and the DNC days. So this was a whistle-stop tour of the ARA. Thank you very much. Apologies for going over there. And yeah, happy to have any questions or any kind of follow-up if interested or needed.
Yeah, thank you so much, Jesse. I know that it's difficult to do justice for such a complex program that you are kind of pushing through, and absolutely commendable. The focus on co-creation and also the inclusive approach that you're taking to build this alliance. So without wasting further time, I think if we can, I would like to invite our next speaker on the panel, Alison Cox. She's the Policy and Research Director at the Global Climate and Health Alliance. Many of you will know it with the acronym GCHA. She is going to talk to us about healthy climate prescriptions for COP26. She began her career with environmental campaigning organizations, including Greenpeace International, and also led the strategy development and director advocacy for global public health alliances. And that really speaks to the strength with the way GCHA is driving, amplifying the voice of global public health and also health professionals for climate action. As Prevention Director at Cancer Research UK, she also led successful campaigns for restrictions on tobacco and junk food marketing and build an international program to support tobacco control advocacy. So advocacy is really at the core of her career. And over to you, Alison, to tell us about what you want to do for climate change.
Thank you very much, Vavati. I'm just going to talk you through some slides, which I hope will be helpful. As you said, I'm Alison. I'm from the Global Climate and Health Alliance. And I'm really going to focus in, we've just had a presentation about research and research into action. This is really all about advocacy and the voice of the health community for strong and urgent climate action. Next slide, please. So by way of introduction, we were founded in 2011 and are an alliance of health NGOs, health professional organisations and health and environment alliances from all around the world. And we represent doctors, nurses, midwives, public health workers and other healthcare providers. And we try to elevate the influential voice of the health community to drive change that protects and promotes people's health by tackling the climate crisis. And we do that through advocacy, policy development, research and engagement. Next slide, please. And our rationale for existence was emphasised again this year by the IPCC report, the latest report, that the UN Secretary General so graphically called a code red for humanity. So to restrict temperature rises to 1.5 degrees Celsius by 2050, in line with the Paris Agreement, really rapid and strong change is needed this decade and starting now. And if we're to achieve the necessary level of change, all parts of national and global society must engage to build that momentum. And so the health sector can and must play a vital role. Next slide. And the motivation for health professionals to be active advocates on climate action is very clear. The climate crisis is a health emergency. It's been called the greatest global health threat of the 21st century. And I'm sure you've been talking a lot about this across your conference. And the health impacts are happening now and are going to get far worse. Health professionals are experiencing them, health impacts in their hospitals, in their clinics and the communities now. And without strong and rapid action, millions more lives are going to be lost this century. So we feel it's health professionals' ethical responsibility to speak out. And the good news is that climate action has health benefits for people now, and the benefits are greater if health and equity are explicitly embedded in climate plans, and significant health cost savings will offset the costs of climate mitigation. So we know climate action within the healthcare sector alone will not deliver a climate that's safe for people's health and well-being. We just can't do it on our own. And so health professionals are therefore calling for action by government and across sectors. Next slide, please. So in the run-up to COP26, there is a drumbeat of health and climate advocacy across the health sector and from health professionals. This slide is just a very rough selection of them. I just want to highlight the Health and Climate Conference that WHO are organising and is being co-hosted with GCHA and a number of others. And the registration for that conference is now open, so I hope the detail of that is being shared with all the participants of this conference. But I'm going to highlight some of the key advocacy elements: the Healthy NDC scorecard, the Global Medical Journals editorial, and the Healthy Climate Prescription itself. Next slide, please. First of all, I want to talk about what we hope is a very useful advocacy tool. It's the Healthy NDC scorecards that we've produced, and these assess the extent to which government's national climate commitments recognise and respond to the abundant linkages with health. Ensuring the integration of health into climate policy protects populations, maximises economic benefit, and builds public backing for the ambitious climate policies which are so urgently needed. And failure to include health in the NDCs is really a missed opportunities for people, the public purse, and political support. Next slide, please. So just to give you a very quick example of what the scorecards look like, this is the scorecard for one country, Canada. The NDCs here were assessed based on their attention to 5 health categories, with 3 points available for each and a total of 15 points. And so you can see on the left-hand side, those categories are the health impacts, health in adaptation measures, health co-benefits, economics and finance. We've also put in some bonus points for specific emphasis on health. Next slide, please. This is the overall ranking of the countries. It's split over two frames. And just to say, top scores went to Cambodia, Cabo Verde and Moldova. And in fact, all of the NDCs which received over 10 points were in the lower middle income countries. You can see in the corner of this slide the link where you can see this in more detail. Next slide, please. I just want to talk very briefly then again about the Medical Journals editorial. This was produced by our colleagues in the UK Health Alliance on Climate Change. This initiative saw over 220 medical journals around the world publish the same editorial, calling out the climate crisis as a health emergency and making the health case for rapid and strong action. It was an unprecedented intervention by the world healthcare community and timed just ahead of the UN General Assembly. Next slide, please. Its main points were that health is already being harmed by the environmental crisis. Emergency action is needed to transform societies and economies right across financial systems, food production, transports and city systems. But such a transformation could realise vast health benefits. Next slide, please. And a major point in this was that equity must be at the centre of the global response, with high-income countries needing to cut emissions further and faster, and that they must go beyond the outstanding commitments to provide the $100 billion a year to the most vulnerable countries. Next slide, please. And this received significant coverage in the press, on social media, and was welcomed by the Alliance of Small Island States, the LDC Group, and the Climate Vulnerable Forum. Next slide, please. So the third action I want to bring attention to is our next one that we're really targeting on the COP, and that's the Healthy Climate Prescription. It followed on from the Medical Journals editorial. We launched it on the same day as the editorials for sign up, and it's been developed by a group of international and national health organisations, and GCHA and the WHO have been providing secretariat support to this. It again recognises health professionals' ethical responsibility to speak out, and it's been already got sign up from a number of organisations. So far we've already got 300 organisations signed up, representing over 45 million health professional workers and over 2,000 individuals right across the health sector and from 79 countries. We can be sure about these high numbers because we've got sign up from large international bodies like the International Council of Nurses and the World Medical Association and many national organisations. But we would really love to see more representations from the small island developing states and particularly from the Caribbean. So please do sign up as an individual or through your organisations. So far, the only organisation we have from the region is the Caribbean College of Family Physicians. So please, this is a big call to you to look at this letter and see if you can sign up both as an organisation or as an individual, and to spread the news. We're going to do a public launch next Monday on the 11th of October as part of a joint launch with the WHO's report on report to COP26, which makes the health arguments for climate action. There'll be an international press release and a press conference. And we're also asking organisational signatories to produce their own press releases and do their own targeting of their national governments. So again, if you sign up, you'll receive information about this, the press release, about how you can target it for your national situation, and get links to the social media. And we'll be taking these messages direct to COP26, and we'll be sharing a video from health professionals around the world as part of the health session at COP26. So I'll finish there. Thank you very much for this opportunity to talk to you about this.
Thank you so much, Alison. We're just coming out of a session where we spoke about the role of national public health institutions, and both you and Jesse has offered us opportunities at both the individual level, but also at the institutional level, to be a part of this, this momentum of bringing together a critical mass of individuals, institutions, and also professional bodies in demanding action on both climate mitigation as well as adaptation. So thank you very much for that absolutely fantastic input from your side. And with that, I will come to our final speaker for today, Dave Mcconnell. Apologies that we had to this should have been the opening statement so that we could really outline the COP26 health program. But Dave Mcconnell, he's a health advisor with the FCDO, the Foreign Commonwealth and Development Office. He's trained as a consultant in public health and has worked in both domestic as well as global public health policy, service development, as well as research. And undoubtedly, I mean, he's obviously worked in a range of high as well as low income countries and different organizations. And currently he leads the climate and health agenda in the FCDO climate, environment and health team, and focuses mainly on the delivery of the COP26 health program. So over to you, Dave, for your input.
Many thanks, Revati. Really nice introduction, and apologies, there was a few IT problems at this end. So, but actually, I think it probably works. It works in some ways better to talk about COP26 and health at the end, because so many elements that are in the other speeches are actually rolled into this program, and I think it helps to outline the fact that this is very much a partnership approach. This isn't about UK government or even about the COP26 presidency leading this. We're a convener and a coordinator, but we have really strong partnersps both across governments in different countries, and also with our non-government partners. Absolutely critical to that, and some of them I've already spoken today. So I'm going to talk a little bit about COP26 and about what the opportunity is for health COP26 and what this really means for us. And so I think what I probably won't dwell on is that relationship between climate change and health. I think that argument is largely won. I don't feel I don't feel you need a session particularly on that. But what I will outline is the fact that it is such a big driver of climate change. Impacts are such a big driver on health outcomes, and that will be felt as climate change drives poverty. We'll see increasing health inequalities, and it will hit those who are most vulnerable and least able to react to it, and also those who contributed the least. So it's those who, there's often a map which Dermot from WHO often shows, and one side of it is showing which countries are responsible for the carbon emissions over the last 50 years, and then it shows the second map is where the impacts will be felt, and they're almost mirror image of each other. So there's a moral duty with that. It also, we have to look at mitigation and adaptation. So mitigation, reducing carbon emissions is absolutely key if we're to stave off the long-term impacts of climate change, and hopefully for it not to get worse than it already is. But regardless of what we do on emissions, we will be living with the impacts of climate change for decades to come. So it doesn't matter what we do in mitigation, we have to improve population resilience. to climate change. And we have to keep a keen focus on what the health and maximising health outcomes for the populations that we serve. So what is the opportunity with COP26? So I think for all of these reasons, that relationship between climate change and health, and also, I think if we're being completely honest with ourselves, there's also an impact from the pandemic. So I think the COVID-19 pandemic has helped to highlight for public and governments alike that there is a really strong relationship between climate, the environment, and health. And we recognise that, and we want to do something about it. And so I think a lot of work over many decades and the particular circumstance that we're in now gives us a real opportunity to build a base on climate and health and really integrate health within COP26, but climate and health negotiations more widely than that. So because of these, health was chosen as one of the COP26 science priority areas. And these are essentially, this is one of 3 different areas, but they're essentially areas where the COP26 presidency decided that we need to have a strong thematic focus on this. And we really need to highlight this through COP26. So with partners, including government partners, but principally our non-government partners, I'll highlight WHO, UNFCCC, Climate Champions team, and Healthcare Without Harm. We've built up and GCHA, not forgetting one of our key partners. We've built up the COP26 health program, and essentially it's got 4 initiatives in it. And the aims of the overall program is, one, that we integrate the voice and the argument, the health argument, behind higher ambition from countries and internationally on climate change mitigation and adaptation. That's really important. The second element is to try and drive out the maximum health action in climate change, and maintaining a health focus as we implement interventions to reduce emissions and improve population resilience to climate change. And third area is really about getting our own house in order, showing that health leadership through our health professionals and their voice on climate change and health, but also in terms of how it is we build, develop and operate our health systems going forward. So we've got 4 initiatives, and you've heard about the first one in detail from Alison, which is really about the health professional advocacy. And this is incredibly important for us. So this is really about bringing that health voice and health argument and that massive impact that health professionals can have in raising this nationally and internationally, and positioning this with governments to try and motivate stronger action. I won't go into any more detail. That's very much been led by or coordinated by a group of external partners, and very much led by the Global Climate and Health Alliance, and we're working with them to elevate that through COP26, and it's a really excellent piece of work. The second area relates to our first speaker around adaptation research, and particularly a recognition that there is a gap on health adaptation research. There's a gap on all adaptation research, but particularly on health adaptation research, and particularly within the interventions which improve a population's resilience to climate change and maximises their health outcomes. And so we're working with the Adaptation Research Alliance to develop a global research agenda on climate resilient health systems, which we'll be launching at COP26 on, we're looking for a session on the 9th. I say, and very much that's really been led by our partners in Adaptation Research Alliance, including PHG and the Red Cross, which is a great piece of work going forward. And the last 2 elements of it are around climate resilient health systems and sustainable low carbon health systems. So this is really about getting our own houses in order. So why climate resilient health systems? Well, because the first thing is health systems are incredibly important in terms of protecting our populations from the impact of climate change. So when extreme weather events happen, flooding, drought, etc., and heat, it's the health systems who really have to pick up a lot of that burden. And if the health systems aren't able to respond effectively and manage those impacts, then actually that's where you see a lot of access to mobility. So we're asking countries to make political commitments to do 2 things. We're asking them first to carry out a vulnerability and adaptation assessment, which is a well-known and used methodology. And secondly, is to take that information and use that to inform a health national adaptation plan, which essentially sets out how they're going to address those vulnerabilities, how they're going to build a health system more vulnerable to the impacts of climate change. The flip side of that is around the carbon emissions that the health system itself emits, and the air quality or the air pollution that's responsible for at the local level. So around 4 to 5% globally, much higher in some countries, but in most countries projected to see an increase as we see demographic change, so higher people living longer in poorer health, and high demands on the health system, but also expanding health systems, which are great. We really want to see that, but how do we do that in a way which is sustainable and low carbon? And so we're asking all countries to do one thing. The first thing we're asking to do is to make a national commitment to develop a plan which sets out how they're going to develop the health system in a way which is sustainable and low carbon. The second element, which is more aimed at high-income countries, but actually it's open to all countries, and we're seeing low-income and middle-income countries really getting on board with this, is for them to set a target date for the health system to become net zero. And same way the NHS in England set a target date to be net zero by 2045 for all of its emissions and the emissions which are outside of direct control. We've also now seen several other countries to step forward and make that same commitment. So this is all happening at the moment, and there's a lot of pressure as we move up to COP26, and we're really hoping to see Caribbean countries really get on board with this and make these commitments on climate resilient, sustainable, low carbon health systems, also just join in with the Adaptation Research Alliance and really push for stronger focus on adaptation research, and also to really support the health professional advocacy. Just before my last point really is, actually, we're not starting from square one here. There's loads of work going on in this space already. This is about bringing it together and having a more strategic and being more strategic about it and having stronger political leadership. And also, we have a massive amount of expertise and technical guidance and tools within this area. So looking forward to a really successful COP for health, but it will be very much dependent on the work of many of the people who've been listening in here today and support that you provide. Back to you, Revati. Thanks very much.
Thank you, Dave. Again, very, very comprehensive and concrete areas where people can consider getting themselves involved, whether it's the 6 principles and the ARA membership or the healthy climate prescriptions, as Alison outlined, or taking these conversations back to national public health institutions or your governments or your academic institutions in what all is being discussed for action-oriented research, but also in the policy space with the NDCs and the scorecard performances. So I know we are running out of time, so I'm going to have 3 targeted questions for 3 of you. If you could keep your responses brief, so maybe we can do another round if that works. So I'll probably ask the first question to Jessie, because I know you have some IT issues ongoing, so probably give you the first question. In the SIDS, there is a huge gap in getting data into policy and practice and public and private sector action. What are ARA's plans for supporting the Caribbean SIDS? I think, yeah, over to you.
Great. Thank you very much. Sorry, yes, I'm having problems here, but I've managed to connect on my phone. You know, you can't trust the Swiss infrastructure these days. That's a great question. I mean, the first part I would say, in terms of plans, that we don't have any plans per se other than the work streams that I outlined. And this is because we are member driven. So the idea is that ARA members who join the Alliance will then help us actually determine the agenda itself. I believe in terms of SIDS, as of now, we have University of West Indies as a member, if I'm not mistaken. I'm not sure of others off the top of my head. That's the first part. And I think the other part is really one of the core aspects of the area itself is about doing research differently. I think many times the idea of data not actually influencing or informing policy sufficiently is because of the way it's done, which is data is created and then passed on and expected to be used by policymakers or decision makers. Whereas if we're able to shift that paradigm, we're able to actually make data produced with those policymakers or decision makers, then I think that the uptake and the use of it will be much more likely.
Thank you very much, Jesse. Over to you, Alison. Great to see the 200+ medical journals editorial. What strategy does GCHA have to persuade the rich to increase the $100 million investment per year? You're on mute. Yeah.
Okay. Yeah, I mean, what we can do is help bring the voice of the health professionals into and the broader health community into this. It's certainly one of the key calls in our healthy climate prescription is specifically on the need for this equitable approach and the need for the higher income countries to make good on their commitments to provide this funding and go further. So what we're hoping is, because health professionals are well respected, reliable sources of information and respected, by bringing our voice, we're hoping that we can bring additional pressure to bear on governments to play their part and to help support this fair and equitable approach to a transition away from fossil fuels. So all we can do is bring our voice. We certainly are represented well in a number of the high income countries, like the US, Canada, Australia, UK, and the EU, and so on. So we're just trying to bring our voice and make that pressure heard, and use every system that we can to try and bring resources to help people do that and recruit others in. So it's very much a mobilization and advocacy effort. And I do hope people will take a look at their NDCs and see if that's useful to them. And again, like I say, please do just engage with us and we'll follow up.
So flex every muscle in your mind. Is that another post COP26 campaign building for finance then, Alison?
Absolutely. I mean, it's definitely one of the key calls for this COP, and you will see NGOs. You know, we work within a much broader network of NGOs working on towards the COP, and you will see time and again. I was just on a call this morning that we are going to be talking about the need to mobilise those resources. It's an absolutely key issue for this COP.
Thank you very much. I'll give the next question to you, Dave. To what extent are Caribbean institutions involved have contributed in COP26 research design, or will that be part of the advocacy process, which is due to be launched?
Thanks. Yeah, it's a really good question. It's one of the things about COPs is that they're global. And when you go out with initiatives and you realise how big the world is and how many countries are in it, it becomes quite difficult. So we've worked very closely with partners through the FCDO global network, through PAHO, WHO, and Healthcare Without Harm. Have all been really key partners in this. So we've had a lot of interaction actually with the Caribbean. It's mainly really been about interactions with the Ministries of Health and the Ministries of Foreign Affairs, and really been about trying to push forward the agenda on developing climate resilient sustainable health systems. But there's a really important aspect of that, which is about the research bit in that, and which needs to be back, which is why we're so keen on the partnership as part of ARA. And that's because whilst there are tools and techniques and frameworks out there for this, there's still an awful lot of gaps within their knowledge, and we don't have time to wait for large double-blind controlled trials to carry this out. We have to move this forward. We have to integrate research within that, and there's lots of really good examples. The Smart Hospitals program, for example, within the Caribbean, and many others. It's about how we influence those and move that forward. And we've got lots of good opportunities for that at COP26 itself to really push that conversation forward.
Thank you, Dave. And I think probably this is also for Jesse, you or Dave. Traditionally, many islands have out-of-date legal instruments. How important is updating legislative instruments in healthcare and climate change with mechanisms in governance to support linkages in healthcare and climate change adaptation?
I can give it a go if I understand the question, Jesse. I think you were handing over. Yeah, it's really interesting, actually. I mean, if to talk about really how it is you bring forward, I think if you really want to make a shift change within the healthcare sector, you do need very high level buy-in to really push forward those agendas. But the reverse, I think they're asking about is how do you then integrate health within those wider climate negotiations, that legislative process? And actually, this is one of the areas that we'll focus on at COP26 itself. So one of the big parts of the session that we'll hold on the 9th, we'll be having some world leaders and some ministers of health talking about this very thing, about how do we get, so we've got a COP26, which has got a very strong focus on health, but how do we, one, stay at the table, and at country level, how do we make sure that health is an integral part of that and part of that process and isn't left out of the climate change discussion? So actually, when we're talking about funding for climate change and we're talking about actions in climate change, health isn't an afterthought. And I think to do that, you do need a change in governance and legislative process to really make that happen, because actually health will just fall out of that very quickly. And health does have a really strong voice. I'm not sure I've entirely answered your question there, but it's a really good question and one to be worked further.
It's interesting because also, Jesse, I think you mentioned that one of the global consultation processes is the governance and leadership component that has come out as, one area where we need more action-oriented research, how to support it. So do you have any thoughts to share?
Great, thank you, and very good question. So first, let me just preface my response with saying I'm not a health expert at all. So I think one of the key aspects about governance really has to do with needing to understand actually who does what and who needs to do what. And this, of course, happens at multiple levels. And I know that within the adaptation space, this idea of vertical integration, of governance structures or policies that actually feed up and down from local level systems, local level actions, all the way up to the national level and potentially even internationally. So I think that's one consideration. And actually one point maybe relevant to this that I think Alison mentioned it, and I found it quite interesting, was about how the NDCs were a missed opportunity for health. And so again, this goes back to the idea of a sectoral focus. And when you look at it from an adaptation perspective, do we take a sectoral focus to this, or should we be looking across sectors, because we need a stronger systems lens, on some of these issues. So it'd almost be a question that I would, pose back, which is part of the consultative process. Is actually, do we understand who needs to do what exactly within these governance structures?
Yeah, and then the matching up, right? Like vertical, horizontal, diagonal approaches for bringing together the different sectors and also the actors who are very key in not just the design and the conceptualization, but also the implementation and evaluation of all of these changes that we are kind of collectively wanting to get moving, actually strengthening. Probably one more question and to the panel, given the correlation between the health of man and his environment, including plants and animals, do you think we dilute resources by having climate and health separate from the concept of One Health, especially in the Caribbean where manpower is scarce? Alison, would you like to make a start?
Well, I certainly recognise the issue that everybody has many calls on their time, and there's any number of different ways of cutting this. So I'd certainly say there should, and my experience is there is a connection between the climate and health and the One Health approach, and we should try and work as closely together across this sort of systems approach as we possibly can, because there's no fine line where these things divide. So. Yeah, completely appreciate the need for coordination and collaboration when we're, basically working across a continuum.
Thank you. Any thoughts from Dave, you and Jesse on that one?
I mean, my view is slightly different, really, on this. I mean, I agree with what Alison's saying, but maybe from the point the speaker was making, I think actually there's two sides to this. We really need to integrate climate thinking into health. One of the things that Alison will know this a lot better than me, but actually when you survey health professionals about what's important to them, they all say climate change, and it's overwhelming. And I was speaking to some partners in Norwegian government today, and they were describing a survey they'd recently carried out. And again, it was no different to the survey that we carried out in the NHS in England. Actually, people were saying, yeah, this is really important to us. And then you get down to the point of like, what's your role in it? I don't really know. And so we have to integrate it through the system. So actually, this is what your role is. This is what you do. This is what it means to you in health. You do have a role in this. But also, we need to integrate back into the climate space. So we can't just shift climate to be off somewhere over here on its own. We need to bring it together and integrate it a bit more. But it's not necessarily easier to do, and it doesn't necessarily mean less manpower. I think's the issue with this. It's more about integration, and often with integration, actually you do save time and resource, but not necessarily. But you may have a massive impact, and that's hopefully the takeaway from that. But yeah, I'm not sure I've entirely answered your question, but it's back to you, Fran.
Jesse, any thoughts on that?
Sure, I can come in not necessarily with a response, but maybe the opportunity, which as you've heard, the consultative process that Dave spoke to as well will be coming out with these findings. And so the question is then what's next, right? COP26 is quickly approaching. We realize that health and social justice must be at the heart of it, heart of the conversations. So what can we do? And this is where the ARA's co-creation space provides a potential space to actually bring together these discussions, discussions around nature-based solutions for climate change and health or other areas. So again, I think it's really breaking out of these silos, as we traditionally speak about, and trying to think of how these different areas can actually work, or how we can work across these different areas.
Yeah, fantastic. So I think with that, we have probably ran out of time, but I would like to say thank you so much to all the panelists. It was another fascinating session that we have seen, and thank you everybody for sharing your thoughts on how we can strengthen collectively the voices that need to be heard in Glasgow in November. Thank you again to everybody who attended, and have a nice rest of the conference. Bye.
Thank you, Revati. Thanks all.
Thank you.
Thank you.